Stem cells are very powerful. I didn't know much about them until I started working on them towards the end of my PhD. They're special cells. They have the code in them to become any cell type in the body. When you think about how a baby develops, it's all the organs in the baby, in the womb, are developing from a single starting cell type, which is a stem cell. So it's a master cell type, has very powerful code in it, and stem cell biologists for the past several decades have been working towards manipulating and pushing that code in different directions so we can make potentially any cell type in the body. And that's interesting for many reasons. So you may want to make cells, human cells, to test drugs, or you might want to make human cells that can be used as replacement therapies for a range of diseases such as type 1 diabetes, where your insulin producing cells are destroyed in the body and you want to give patients a dose of brand new cells because that would fix the broken parts of the body. That's what the entire field of regenerative medicine and stem cell-based therapies is about. How do we produce human-like tissues that have true functionality and behave just like the cells that we have in the body? But of course, biology is really complicated. It's not easy to push that stem cell code in the directions you may want to, just because we don't understand all the knobs that are being turned. And at Cellino, we built a system that allows you to take a stem cell and differentiate it or convert it into a mature type of tissue in the body that is super valuable for regenerative medicines. And the way we do it is we use a range of different technologies coming from physics, coming from engineering, biology, machine learning, to start with stem cells and differentiate them to a sheet of highly pure tissues, just like the ones we have in the body. It's a lot of work, but it's super interesting and fascinating to see what can be accomplished in biology when you put all these different disciplines together. So Cellino's first area of focus are cells in the human retina, so the back of the eye. The retina is very interesting. It's a very small organ, but it allows us to see the world we live in. When you think about sight, it's a human sense that gives us independence. So when you take sight away from people, it completely changes their lives, and they're not able to live their lives the way they used to. There are a lot of diseases that affect the retina. So, for example, age-related macular degeneration, AMD, is a disease that affects retinal cells, and basically your retinal cells are dying slowly because due to aging, and as they're dying, you're losing your vision. So most of these patients are in their 50s or 60s and undergoing vision loss, which is severely impacting their ability to live their lives. And there's a new way of medicines emerging right now, led by top pharma players in the industry, where stem cell-derived retinal cells are being transplanted into the back of the eye to restore vision and sight again. Cellino is focusing on this particular area as our first cell type because we know that early clinical readouts are becoming available. So we know that putting a stem cell-derived retinal sheet into the back of the eye can restore vision to a certain degree. But there are immense challenges in the industry in terms of manufacturing these cells effectively, making high purity sheets that can integrate into the back of the eye, having single cell precision to make sure that every single cell that you're transplanting into the eye is accounted for, is mature. And our technology, what it does is it combines image-based machine learning to track that as these cells are being differentiated from a stem cell to a retinal cell, that we're making the most mature version of the retinal cell that we possibly can, so that it has the greatest functionality once it's in the patient. So what our system does is it takes images of cells and then it can target single cells for genetic activation if necessary, or even removal. That's a huge unmet need in the regenerative medicine industry, being able to remove cells that aren't differentiated properly, and maybe they're becoming a muscle cell or a skin cell. You don't want that in the retina. So we're bringing single cell precision to the industry.